This video will illustrate a protocol for performing an injection of platelet-rich plasma for tennis elbow. The platelet-rich plasma product utilized in this video is the Biomet GPS-3. Attach an 18 gauge needle to the 16 ml syringe and withdraw 6 ml of ACDA, which is the anticoagulant. Next, attach the 18 gauge infusion cannula to the syringe for venipuncture. Next, withdraw 54 ml of blood into the syringe. Once the blood has been collected, transfer contents of the syringe into the separation tube through the central port. Insert the separation tube into the centrifuge. A counterbalance with 30 ml of sterile saline is placed into the opposite side of the centrifuge. Set the speed for 3200 RPM for 15 minutes. When the centrifuge is finished, the platelet-rich plasma can be extracted from the tube. Demarcate the exact area of tenderness with a permanent marker in order to localize the area to inject the platelet-rich plasma for best effect. Prepare the skin with a cleaning agent and inject 2 to 3 ml of 2% lignocaine, just superficial to the tendon, using a 23 gauge needle. Local anesthetic can make the procedure easier and less uncomfortable for the patient. Note that it's better to inject the local anesthetic at least 5 minutes before the platelet-rich plasma injection. Therefore, an appropriate time to do this is whilst the centrifuge is running. Attach a 23 gauge needle to the syringe of platelet-rich plasma. Place the needle perpendicular to the skin in the center of the previously demarcated area of tenderness. Advance the needle through the skin, subcutaneous fat, and into the tendon. Then inject a small volume of platelet-rich plasma. Withdraw the needle just out of the tendon and then back into the tendon in a different position within the demarcated area, injecting a small volume of platelet-rich plasma in each area. Continue this peppering maneuver 15 times throughout the demarcated area. If the platelet-rich plasma finishes before this, it is important to continue, as dry needling has been shown to be effective in tendinopathies. Once finished, place the dressing over the site of injection and we would advise that the limb remains in the same position for approximately 15 minutes to keep the platelet-rich plasma localized to the injection site.